Hello, everyone. My name is Misael Hernandez, and I'm with the People's Academy of Sciences. And today I want to discuss critical thinking. So the main question at hand today is, what is critical thinking? And throughout the years, I've heard like a variety of explanations or definitions. The one that I hear the most is like, oh, it's thinking outside the box. Well, all those are fine, but we're going to try to narrow it down to something more specific. And so for me, when I was in high school, I got my CNA certification. And so I remember that as a CNA, I have to think critically because sometimes your patients have like hemiparesis, and when you're dressing them up, you have to find out like, okay, which arm does the sleeve go in first, you know? So that involves critical thinking. As a licensed nurse, when you're giving medications, you want to find out, hey, can I give this medication based on the vital signs, based on the parameters? So that's why critical thinking is very important, and in particular in education. Because for the past 15 years, I've been in education, I've been a nursing educator, and not only as an instructor do I have to continuously critically think because I have to find ways, entertaining ways to convey information to the students, but I have to find ways that they don't just memorize stuff, and I have to engage the student and they have to trust me that I know what the hell I'm talking about. And so that's why critical thinking is very important. But as a student, okay, as a student, you guys also have to be able to look at vital signs and say, okay, the patient's heart rate is 150, blood pressure is really high, temperature is really high. What's going on? What do I do next? And this is why critical thinking is very important. As a student, you have to find ways to really understand and comprehend concepts. And so you ask yourself the big question, right? How do I critically think? Well, there's no specific answer to this. It's a composed of a variety of tools, I think. And I think today we're going to be exploring that, okay? And so Webster defines critical thinking as the act or practice of thinking critically, such as applying reason and questioning assumptions to solve problems, evaluate information, and to discern biases. Because we're all biased, and I don't think anyone's more biased than I am. I have a whole list of biases. However, I have to always check them to ensure that I'm giving you guys comprehensive information, and that's why I got to check my bias. So, as a student asks themselves, so what is the definition of critical thinking? Because we've been talking about it, but we haven't really given a definitive answer. And so, even though we've discussed Webster's answer, I came up with my own. It's a little bit more basic, a little bit more simple. And I believe that critical thinking is the ability to reach a sound and plausible conclusion, even when only limited information is available. What that means is you can come up to a conclusion that sounds reasonable. Doesn't mean it's always correct, but at least it has some meat behind it. And so we can look at this picture right here, and this would be a little exercise. For some of you with sharp eyes, you probably know who this person is. But for some of us that don't know, well, you have to use available information. Hopefully, you've watched some media in the past several years. You've been on social media, you've watched a few documentaries, a couple of movies, and you probably know who this is because the question is, who is this guy, right? Well, for those of you with sharp eyes, you probably already know that it's JFK and John F. Kennedy, right? He was our president, and he was assassinated on November 22nd of 1963. And this was AI generated, as you guys can see. They're still working on their progress as well because I was like, man, his face looks a little weird, but nonetheless, critical thinking yields an answer, and it's JFK. Why? Because we know the stature. We know the particular posture that he has, the haircut that he has, and that's being able to critically think and coming up with a conclusion with limited information. And so, what does active critical thinking look like, though, right? So, for this reason, I put together a little show that you guys have probably seen before, and you should be warned that the following content does contain graphic images. And so, for those of you that are squeamish, please stop watching this now. Okay, I don't want to get sued or anything like that. But in this picture, we have a video of the JFK assassination. So I want to use the JFK assassination to explore critical thinking. We have objectivity, what we can see, what we can measure, what we know is a rule of physics. Let's say that an object in motion will continue in motion unless it's steered by some other force and stuff like that, right? So this is why I want to go ahead and show the JFK assassination video. I want you guys to look at it. They pass this on every anniversary on TV, TLC, one of those science channels. So please don't be upset about me showing this. Let's take a quick look. And I want you guys to pay close attention to the direction of the head movement in the last kill shot. try not to narrate too much, but in essence, he's in Dallas, Texas, and he's coming through with the motorcade. And I want you to pay close attention to what's going on with him because we're like investigative journalists here as nurses. We're trying to find out what's going on. And pay close attention to the head. Oh, okay. So critical thinking is, my definition is to come up with a reasonable conclusion with limited information. Now, let's take a look at this one more time just to make sure that we caught the important elements because I think they're very important. When you guys are doing NCLEX questions, you have to read it more than once, right? And so kind of this is what we're doing now. So again, here comes JFK, passing that sign, and you'll notice he grabs this. Something's going on there, right? And there you have it again, folks. So critically thinking, what happened? Who shot him? Where did he get shot from? Now, who shot him is well, the Lee Harvey Oswald, right? According to the Warren Commission. But if we look at these still frames, if we assess, if we explore possibilities, you can see his head is kind of facing down a little bit. This is the explosion of his head splattering open. Notice where its location is at. Okay, here's the back of the head, and this is not the front of the head, but there's something going on right there, right? And then if we look at this picture, you'll notice that his head is no longer in that same position. It's, in my opinion, moved back. Okay. So what does critical thinking tell us? Well, we don't know, right? We can discuss this all day, but we do have some authoritative truth, and that is the Warren Commission. The Warren Commission is the official story, the official narrative of what happened to JFK on the day of November 22nd, 1963. Okay. And so what critical thinking tells you is that even though the Warren Commission states that he was shot 3 times or shot with 3 bullets, excuse me, they all came from the back. There was only one person involved. One shot missed. The second shot hit him at the base of the neck, the top of the back, and then the last shot hit him in the back of the head. That is the official Warren Commission. But what does critical thinking tell us, folks? Well, we have to find an established way to follow like the scientific method, right? We have to have steps, we have to have rules. And that's where this comes in. So the first thing you want to do in critical thinking is you want to apply reason. Is it reasonable to think that he got shot from the back based on what we witnessed right now? And that's up to you guys to decide, right? The second thing you want to do is you want to question assumptions. The assumption was there was only one shooter. The assumption was that there was only 3 shots. The assumption was all that other stuff that I've been talking about, right? The third thing you guys want to do is evaluate the information. The Warren Commission states that he got shot from the back, so that tells us that his head should have moved where? Forward. But what did you guys see? Okay, so you want to evaluate the information. And lastly, you want to discern bias. I'm biased, folks. I'll be the first one to admit I'm very biased. So I have to continuously check my biases, right? Because my bias may influence my response, and we have to be very in tune with what our biases so we can check them and we can move away all that other information, all that other subjectivity, and look at the objective truth, what we have in front of us. So right here, we have a little scenario, right? Mr. JS, age 45, he's a male. His chief complaint is bone pain and shortness of breath after walking short distances. Some background information includes Mr. J is 45, I know a little typo there, but he presents to the emergency department complaining of generalized bone pain and increasing shortness of breath with moderate physical activity, such as walking from the parking lot to the front entrance of the hospital. His vital signs are as follows. Blood pressure is 156 over 92. Heart rate is 102. Respirations look good. Temperature looks good. SpO2 looks pretty good, right? So we have this information in front of us. What do we do with it? What does critical thinking tell us? Remember, to come up with this information, to come up with a sound, plausible conclusion, you have to have some foundational knowledge and you have to test it, right? So we go to those 4 steps again. Apply reason, right? And so the reason is reasoning means that we have bone pain and shortness of breath. Is my assumption now, my assumption right now is that, he's got hypertension. What can happen when you have a lot of hypertension? Your kidneys can be affected. Maybe this patient is developing kidney failure. Maybe he has chronic kidney disease and he doesn't even know about it because a lot of us don't even go to the doctor, right? So does my assumption have any reason? I think it does. I understand that as a foundation, when somebody has kidney failure, their calcium goes down. So they develop porous bones like osteoporosis, right? We also know that patient with kidney failure may have fluid volume overload. Maybe that may affect his lungs. Maybe the patient has anemia. Maybe that's why they're short of breath. My point is, we're exploring these possibilities and we're finding out the number one statement. Does this apply to reason? And I think it does so far. Then we have another component. Why is this patient experiencing this, right? So why is the patient having bone pain? I've already suggested, I think it's happening because the patient might have osteoporosis related to low calcium levels because they have kidney failure. Maybe they're short of breath because they have pulmonary congestion because of the fluid retention. Maybe they have anemia because there's no more erythropoietin because the kidneys are failing. My point is, you must question your assumption. You have to check it. Does it make sense? The third thing you want to do is you want to go ahead and evaluate the information. So are these values or these assumptions therapeutic? Meaning the values, is a blood pressure high or low? Is it normal? It's high. Is the heart rate is high, right? The temperature is high. So are they therapeutic? Are they abnormal? And you want to evaluate all these elements that you are suggesting for this potential response to these critical indications. And the third thing you want to do is you want to discern bias. Now, is my understanding of pathophysiology aligned with objectivity, or do I have a preconceived notion of what this may be? What that means is sometimes as students, we'll read a question and then we will look at an answer or a word in one of the possible answers that jumps out at us. Now, is that jumping out because it resonates with objectivity and critical thinking? Or is it just because we saw a word in the question and we saw a word in the possible answer and they connect because they're somehow related? But is that my bias? Am I saying that B or A is the answer because it has a word that reminds me of the question? Or is it true? Meaning, does it stand the test of time, or do all these elements apply? Does it apply reason? Are we questioning the assumption? Are we evaluating information? And are we discerning bias? Okay. And that pretty much sums up my critical thinking, folks. I hope you guys follow me on YouTube, People's Academy of Sciences, Instagram, and I'll see you guys soon.